The new coronavirus has spread significantly worldwide since it first emerged in China in December 2019, making it a global pandemic, per the World Health Organization (WHO). There are over 1,914,916 confirmed positive cases and counting of COVID-19 around the globe, according to a WHO report on April 15. As countries and cities continue to enforce social distancing, encourage self-isolation policies, and postpone major events, including the Olympics, one question is likely on your mind a lot: when will this pandemic actually end? The short answer is, no one can say for certain. But infectious disease specialists and researchers have some thoughts to help put this global health situation into perspective. Honestly, it's impossible to say if and when the coronavirus will die down because it's a totally new virus, and therefore unpredictable, says Fahim Younis, MD, the chief of infectious diseases at University of Maryland Upper Chesapeake Health. But pandemics have happened before, and they eventually pass as they become more contained, and as vaccines are developed and distributed. But researchers do look at past pandemics to make very baseline predictions about when it might end. And in the past, pandemics have typically lasted between 12 and 36 months. Here's one example of the timeline of a past pandemic. In 2009, a novel H1N1 flu pandemic occurred. Remember swine flu? The WHO declared a pandemic that June, and by mid-September, the FDA approved 4 vaccines for the virus, and they started getting administered in October. In late December, vaccination was opened up to anyone who wanted it, and the pandemic was deemed over in August 2010, according to a timeline from the CDC. You may have heard a pesky little rumor that the COVID-19 pandemic might die down in spring, summer, since the spread of other types of coronavirus tends to peak between December and March. But, again, it's hard to know which way this virus will go, says Sandra Kesh, MD, an infectious disease specialist and deputy medical director at WestMed Medical Group in Purchase, New York. At this point, experts simply don't know enough about how COVID-19 spreads, and how shifting weather and temperatures may or may not affect it, according to the Center for Disease Control and Prevention, CDC. Another reality is that changing seasons tend to have less of an impact on new viruses, says Dr. Kesh, so you can still get sick outside of the typical winter season. And, remember, this is global, so it's always winter somewhere. As such, the situation could potentially improve in one hemisphere when summer arrives and simultaneously get worse in another because, yep, it's winter there, explains Dr. Younis. Ruth is, you'll have to go with the flow as novel coronavirus continues on, as the future remains unknown. But ultimately, the future of the novel coronavirus pandemic depends on how we respond to it together, and there's plenty you can do to help, experts agree. Follow the rules regarding social distancing and self-isolation in your location, stay calm as much as you can, and stick to the basics, too. Wash your hands often, keep them away from your face, know what symptoms to look out for, stay in and away from at-risk populations like the elderly and immune-compromised when you're sick, and encourage your friends and family to follow suit. If you liked the video, please subscribe and like.